Dr. the Honorable Christopher Tufton, Minister of Health and Welfare. Okay. Dr. the Honorable Christopher Tufton, MP, Minister of Health and Wellness. Dr. Joy St. John, Executive Director, Caribbean Public Health Agency. Mr. Dunstan Bryan, Permanent Secretary in the Ministry of Health and Wellness. Dr. Karen Webster Carr, Acting Chief Medical Officer. Mr. Howard Lynch, Chief Technical Director. Mrs. Maureen Golding, Chief Technical Director of Health Authorities. Mrs. Patricia Ingram Martin, Chief Nursing Officer. Ms. Rowena Palmer, Policy Director, International Health, other directors in the Ministry of Health and Wellness, distinguished guests, ladies and gentlemen, members of the media, those in the room and across the Caribbean, good afternoon. I am Giovanni Brady, Public Relations Officer in the Ministry of Health and Wellness, and it is my pleasure to welcome you to the media launch of the 66th CARPHA Health Research Conference, the largest of its kind in the English-speaking Caribbean. This conference has a long history of seeking to drive the difficult conversations that need to be had surrounding the various health and environmental challenges being faced in the region, while seeking to find long-term, tangible solutions for these issues. This year's conference also holds major significance as it is the first to be held since the onset of the COVID-19 pandemic in 2020. Jamaica was scheduled to host the conference that year prior to the pandemic, so it is perhaps fitting that we have been chosen to continue where we left off on that journey. That experience has heightened our excitement for this year's staging, as we look forward to the rich exchange of knowledge to take place on the island as we seek to play our part in pushing the Caribbean towards a brighter and a healthier future. I now invite our Minister of Health and Wellness, Dr. the Honorable Christopher Tufton, to give his remarks.
Thank you very much, Chairman Giovanni Brady, who has just made his debut as chairman of these proceedings. Member of the PR team, I can see that Stephen is spreading his wings to expose the younger people. By the way, he went to a good high school, Manchester High, my high school. All right, so let me begin by welcoming our specially invited guest, who you will hear from momentarily. That is Dr. Joy St. John, Executive Director of the Caribbean Policy Health Agency, CARPHA. And for those who may need some clarity, CARPHA is the CARICOM's public health agency. So CARPHA is our equivalent of the Caribbean, CARPHA is our equivalent of maybe what APAHO does for the Americas, right? Very important to us. We are member states, and absolutely critical to helping to guide us on critical public health matters, including the 2-year-plus journey of the COVID-19 pandemic, providing lab tests, providing expert advice, training, all the critical things. And we do have a few Jamaicans there who we're very proud of. And Dr. St. John is the lead of that agency based in Trinidad. I want to welcome you to Jamaica. She's no stranger to Jamaica. She has been here many times. She can speak for herself. And I believe, something tells me, she's always happy to come back. She can tell you why, right? I want to just welcome also the Ministry of Health team who are here. There are quite a few. Our acting CMO, with Dr. Webster Carr, Mr. Lynch, who heads up the policy unit, chief nurse. I haven't seen you in a little while. Good to see you. And the rest of the team representing a range of other units, project management, IT, and others. I want to just recognize Professor Ferguson, who is Director, Epidemiology Research Unit, Caribbean Institute for Health Research. And he is, Professor Ferguson, that is, a big part of our research program, chairing our research committee. I can't read your lips because you have on the mask. It's one NCD committee, one of the hazards of the job, you know, this mask wearing, which I'm trying to, well, let me not say it because I'm supposed to be providing an example. All right, the rest of you in the room, media and others, thank you very much for coming. And those in technology land out there. Some of you in the region, in CARICOM, as well as beyond, and of course in Jamaica, and to the media folks who we appreciate your coverage at all times. Really want to welcome you to this, this media launch of what is CARPHA Health Research Conference, which will take place shortly. So I want to begin this afternoon with just commending CARPHA and the Ministry of Health and Wellness on the delivery. A lot of plans in progress, and we know it will be successful, of the 66th CARPHA Health Research Conference, which is set for September 15th to 17th at the AC Marriott Hotel here in Kingston. So a lot in store at the AC Marriott as it relates to public health and health research next week, 15th to 17th. I think we can all agree on the value of health research, more so in the last few years where health has been the most current and topical issue, where life and death depended on it. I think its significance needs no debate or prompting, because we've all lived it, we've experienced it. And so it is through research that we ground the policies that provide the protection for the people. And we have to keep doing it because life evolves and we have to evolve with it. So from investigations into disease trends, risk factors, to the outcomes of treatment and public health interventions, cost related to those interventions, and so much more. The research agenda is wide and getting wider each day with every emerging threat that exists out there, which changes its complexion and its impact and its name. COVID-19, monkeypox. I don't know what the two have in common, but one right after the other, right? And we have to get used to it. And I'm sure there'll be another in due course, hopefully not too early. The focus of this year's CARPHA conference, COVID-19 and digital health, transformation, connecting, informing public health, is for us timely, as it's important and aligns the strategic priorities of the Ministry of Health and Wellness. Those priorities include the prevention and care management of non-communicable diseases, NCDs, which, as you know, is a scourge on our society in Jamaica, but in the Caribbean, where over 75% or so of Jamaicans, regional people, are afflicted by some sort of NCD or lifestyle disease, hypertension, diabetes, cardiovascular disease, renal issues, and meet their demise because of those diseases. The data is evident to support that. Again, research that has been done, 1 in 3 Jamaicans, for example, are hypertensive, 1 in 8 diabetic, 1 in 2 overweight or obese, putting them at risk for developing an NCD. However, with interventions such as the U.S. multi-million-dollar health system strengthening program, which the government of Jamaica, the Ministry of Health, has embarked on, we are fighting back. We are tackling the challenges of our disease profile of NCDs in a range of ways. You would have seen in this very room where we unveiled the new Spanish Town Hospital and the capital investments that we're embarking on, the largest in Jamaica's independent history, as a recognition of the importance of that challenge. And the health system strengthening program is making that attempt to ensure that health response is relevant, is applicable, and effective. The program, this particular program, financed by the Inter-American Development Bank and the European Union, together, very importantly, with supporting from the Jamaican government over the next 3 to 5 years of about 87 million US dollars, almost 15 billion Jamaican dollars, has as one of its key deliverables the build out of an ICT infrastructure to support the digitization of Jamaica's health system, including the application of telemedicine. All of this is informed by research. Or these decisions are large decisions, involve a lot of money and risks. Mr. Bolton is right there, Sean Bolton, who is our IT czar, and he knows that if we slip on some of the work we're doing, or it's not relevant, a lot of money goes down the drain. Health research is critical to that, just emphasizing the importance of this conference. Our experience of the COVID-19 pandemic has showed us the value of digitization to health system resilience, what digitization does in creating the enabling environment for safeguarding continuity of care to patients through the offer of collaborative care, cost control, and population health management. At this year's CARPHA conference, therefore, digitization is being given the sort of attention it needs, even as we provide the platform for learning and planning through knowledge and experience sharing. If you look at the agenda for this conference, we have so much in store. I mean, we are truly a one Caribbean approach in terms of the work from Trinidad, Barbados, all over, and even outside of the region, once it's relevant to our experiences. So it's about shared experiences across the region and beyond. In short, ladies and gentlemen, this year's conference with its focus on digital health, for us it's a big deal because we are embarking on that and we have to learn as we go along. The very format of the conference, combining face-to-face with online engagement and sharing, is indicative of the changes that are required of us as we look to ICT to enhance the delivery of the highest quality of patient care in public health in Jamaica and across the Caribbean region. So, you know, sometimes we speak in research terminology. It's important that the average man listening out there understand. In other words, the University Hospital of the West Indies that have all the specialists, eye specialists, renal, kidney specialists, cardiovascular specialists, cancer specialists. We don't have one of those specialists in every hospital in Jamaica or every health center in Jamaica. So my constituency in St. Catherine, West Central, with a clinic called Kitson Town, or the Kenbaugh Health Center up in Point Hill, where nurses are and doctors are periodically, we are putting in place the ecosystem, the infrastructure, where the specialists at UWI can examine the patient at Point Hill using different devices to insert in the ears, in the nose, wherever, and can make an initial diagnosis and recommend further action to take place in a way that is accurate. Certainly, consultations will follow on, but it saves time. Patient don't have to travel from Point Hill to UWI. It is efficient, and it addresses the concern in a way that perhaps would have not happened if that patient had to come in. That's the kind of technology we're talking about. We're talking about patient files not being paper-based. So when you go to a hospital, you don't have to wait until somebody go down to the filing room to find the document. Sometimes lost. Sometimes it takes days. Sometimes it's incomplete. So you don't know the history of the patient. You put that on the system every time the patient comes, and after 10, 15 years, whether they were at the health center or the hospital, you know the history. You know which medication they're allergic to. You know which medication they have been taking. You know the progression of their health status, and you are able to make a decision as to how to respond. It reduces time and it reduces cost, and ultimately the patient becomes the center of the treatment. So that's the kind of practical benefit that will flow. All of this grounded in research of one form or another. Of note, and I want to mention this one because of my experience over the last couple of weeks going to outside of Jamaica to a conference around strokes or stroke and the impact of that on our population. There are many studies, but this particular one will be unveiled. This is our sodium or salt study, which we initiated here in Jamaica and have insisted on doing, as we have done a few others. And we will be unveiling the key results, the high points of that study, because we think it's so relevant to us. You know, we live in a country where we love salt and sweet. Am I wrong? All right. Concentrated sweet, sugarcane juice in the bottle. You know that, right? What's the other name for it again? What is concentrated sugarcane juice in a bottle that we manufacture here? All of you would lose Cool Challenge quiz. No more rum. Everybody drink them little rum now and then, white or red, right? Including me, by the way. So let me not try to be different from any of you, right? But the point is that we like the salt and we like the sweet. And, you know, it really is a part of our culture. And frankly, we should enjoy it, but it should be done in moderation. And it does have an impact on our profile, our health profile. So we did the sodium baseline study. That has shown, as part of the health promotion and public education, which we want to start with the results of that study, as part of the NCD challenge. We launched this study around sodium and potassium consumption among members of the population. As some of us, as I said, would recognize, high sodium consumption and low potassium intake contribute to high blood pressure, hypertension, and the increased risk of heart disease and stroke. Cardiovascular disease is our number one killer, right? So Prof here can give you all the explanations of that. You know, I became a lot more knowledgeable around stroke when I went to Brazil recently at a stroke conference. And a part of that brief, of course, is looking at the impact of stroke on our population. In 2021, over 7,000 Jamaicans had a stroke. Over 2,400 died from the stroke. And the rest of them, or us, had significant debilitating effect. Loss of motion, loss of speech, and by it's extended effect, you know, can't work, you know, and so on. And not to mention the fact that once you have one, the probability of having another, I am told, is quite high in over a period of time. And the cost of treatment. Now, we have to put provisions in place to deal with these things as a country. We have an obligation as government, but we also have to recognize, and we have an obligation to explain to people, to Jamaicans, to citizens, to all of us, that there are ways to minimize that ultimate end, and indeed even to eliminate it. If you cut back on the salt, and the alcohol, by the way, then the hypertension may not come on, or may come on at a point in your life when you're preparing your mortality to meet your maker. Because after you have a full life, we all will die, right? We're not expecting to live forever. What we don't want is premature illness. We want to be productive during our productive years. So we've done that study, and you know, I said some time ago in a meeting around with regional stakeholders, looking at strategies to reduce salt consumption for prevention and control of NCDs in the Caribbean region. I said, to say that Jamaica has a significant high blood pressure problem is not an understatement. And even more alarming is that we are not alone. High blood pressure in our people in the Caribbean is a Caribbean-wide problem, and it is one of that threatens to become even more so a challenge unless we address the risk factors, including high salt intake. And by the way, I learned this. I'm a social scientist, not a clinical scientist, and I learned that you have salt and sweet in almost every natural thing that you eat, right? So your body naturally gets salt from. Give me one of the products, Professor. You have a talk without the boss, though. So what has natural salt in it?
Certainly you have some of your regular fruits,
vegetables, ground provisions, low quantities. So
of course, the things that we look at are the processed foods.
Processed foods is where you have the big issue. Those things in tins that are stored up. You know, I see people doing now, when they buy these things, they wash them before they put them and eat them, right? Because they're trying to get rid of some of the concentrated sodium on it. Anyway, so these are the findings of this $13 million study. This is the only one I'm commenting on. There'll be several others next week. $13 million study on salt. 67%, or 2 out of every 3 Jamaicans, consume more than the recommended sodium intake, which is about 3.6 grams daily, above the recommended level of 2 grams daily. 2 grams daily recommended. We're almost doubling that, 2/3 of the population. That's why 2/3 of the population, or certainly contributing factor, why 2/3 of the population have cardiovascular related issues, right, Doc? It contributes to it. Not the only one, but it contributes. 73% of males have higher than recommended levels of sodium intake, with prevalence highest among men aged 45 to 54. 60% of females have higher than recommended sodium intake, ages 35 to 44. And importantly, the estimated mean sodium consumption suggests a pattern of high sodium and low potassium consumption for almost 30 years, with results reported from phase 1 of the study similar to those from the Spanish Town cohort study of the 1990s. So we have longitudinal, time series of studies that gives us a trend and a pattern that shows that the situation is not getting better, it's getting worse. But so is the disease profile and the mortality rate related to that disease profile, which is why we have to cauterize. And that echoes, in a large way, the value of research. Because without that, we would be a runaway train, not recognizing the crash up ahead. At least the public can be aware that this is the likely consequence. And I tell you, I get too many requests from persons about support for their auntie and their grandmother, and in some instances, even young people who are faced with this eventuality, which oftentimes can be avoided. So the study is suggesting that the majority of adult Jamaicans have an issue, and we have to continue to do the work. We have to continue to provide the information, so public education is key, and use that information to influence policy. Ultimately, that's what it's all about. Take the data, so when we make an announcement, as I believe we ought to, in an activist advocacy way as government, which I think government must play a greater advocacy role beyond the policy alone. We must talk to people about things around knowledge of the consumer through front of package labeling, around school nutrition to restrict some of the foods that our children are eating, which develops into bad habits and premature illness, around less sugary drink, around managing alcohol consumption and underage drinking, and I could go on. It really is an attempt, in the first instance, of using the research information to push best practices so people can enjoy better quality of life and reduce the risk of the cost associated with illness, the cost and the hurt associated with the loss of a loved one. So research is powerful, and our policymakers depend on research. And here in the Ministry of Health and Wellness, as is the case with CARPHA, we embrace research, sound research, good sound methodology, and we speak from the data. We don't speak only in anecdotes. And therefore we stand, I was going to say stand firm, but let me not use that word. We stand on solid ground. Much better. In terms of some of the pronouncements that we make around some of these issues, because it's grounded in that kind of data. So, there are other things that are coming. I'm closing now. COVID-19 vaccine hesitancy in the Jamaican populace, a perspective on primary care providers and policymakers on the impact of COVID-19 on the health system in Dominica. I'm giving you some of the research that will be unveiled. Psychological effect of COVID-19 on Trinidad's healthcare workers in primary care during the pandemic. And I could go on and on. There is a list of research topics that are going to be unveiled and discussions had that will benefit the Caribbean in terms of moving this process forward. On a final note, I want to say that one of the highlights of the conference will be the launch of Caribbean Moves. And I have to mention it because this is personal to me. It's near and dear. And I know in Jamaica we have seen the rise, the fall, and the relaunch of Caribbean Moves for reasons we won't go into right here. Jamaica Moves, sorry. But I have high expectations for what I think is a good thing and has really started to capture, certainly prior to its temporary suspension. The imagination of a people who rightfully, I believe, should place greater emphasis on themselves, self-care through physical activity, through proper nutrition. And what Jamaica Moves was, and I hope it will be with the relaunch, is an attempt at tapping into the positive aspects of our culture, the music, the colors, the festivities, and leaving out the aspects that creates excesses that lead to a disease profile that we currently have. The excessive consumption of alcohol, the smoking of whatever herbs and spices we like to smoke when we're out there on the street, and other things. You know, when we had the heights of Jamaica Moves, I recall the last parish event we had in Portland, we had almost 5,000 people, and they were dancing to Ding Dong and others, right? One of my favorite artists, for 6 hours, and the only offering at the venue was water, the most nutritious product known to man, liquid, water. And it was a great event, and nobody left there falling over a stone or a bucket or a car. And the possibilities of accidents occurring were almost minimal, if not totally absent. We're bringing it into the schools, and we're promoting lower sugary drink consumption. Who wants to participate from a commercial standpoint? Reformulate. We're not leaving anybody out. But the children must get the best nutrition so they don't get premature illness. So Jamaica Moves is back, but more importantly here, Jamaica Moves has had some influence, not just on Jamaica, but on the region. And I'm very proud, extremely proud to say that CARPHA, supported by the Caribbean Development Bank, supported, of course, through its parent organization, CARICOM, will be launching Caribbean Moves, patterned off the Jamaica Moves program, which will seek to establish a similar type of infrastructure and ecosystem in every Caribbean country across the region, because we all suffer from the same issues, lifestyle-related issues. And I really have high hopes for this and look forward to the launch. You'll get more information on it. It's a virtual launch, so we hope that other Caribbean islands who are not here will participate. And we hope that, we want to say that, you know, forgive me, Dr. St. John, I know you're honorary Jamaican, but I have to say, you know, it's another reinforcement of Jamaica leading the way in providing a good program, to say that. But it's a good feature, and you'll hear more of that. So thank you very much. I know I've been a little long-winded, but very important event that's coming up. I want to commend Dr. St. John and her team and the ministry for the local organization and the regional organization. And I want to say to the media who are here and those listening on, give us a listening ear with some of these research documents and help us to provide the information out there, because at the end of the day, it's done for the people. If it's going to be packed on a shelf after we finish it, it makes no sense. It must be applied research, and it must influence policy and lifestyle ultimately. Thank you.
All right, thank you very much, Dr. Tufton. Voted the most, what was it, hardworking? Best minister?
That's in your speech.
No, that was all me, that was all me. That was all me. All right. So we are also pleased to be joined here today at our media launch by Executive Director of the Caribbean Public Health Agency, CARPHA, Dr. Joy St. John, and other members of her team. Dr. St. John rose in the ranks of public health in Barbados to become the first Barbadian Chief Medical Officer in 2005. She represented Barbados on the executive board of the World Health Organization, WHO, becoming the first Caribbean chairperson of the executive board in 2012-2013. In July 2019, she became executive director of the Caribbean Public Health Agency, CARPHA, and led the CARICOM regional public health response to the COVID-19 pandemic. We now invite Dr. St. John to bring her remarks.
Thank you, Master of Ceremonies, Dr. the Honorable Christopher Tufton, Member of Parliament, Minister of Health and Wellness. Mr. Dunstan Bryan in his absence. Can you hear me better now? Okay. Mr. Dunstan Bryan in his absence, my favorite permanent secretary of the Ministry of Health and Wellness, Dr. Karen Webster Carr, Acting Chief Medical Officer, Mr. Howard Lynch, Chief Technical Director, Ms. Maureen Golding, Chief Technical Director of Regional Health Authorities, Mrs. Patricia Ingram Martin, Chief Nursing Officer, Ms. Rowena Palmer, Policy Director for International Health, Directors of the Ministry of Health and Wellness, distinguished guests, ladies and gentlemen, members of the media, a full page of salutations. Good afternoon. Thank you to the media for accepting this invitation to help disseminate the good news happening right here in Jamaica. This occasion is a remarkable one. The 66th CARPHA Annual Health Research Conference is the first hybrid conference in more than 6 decades of its hosting. CARPHA is very happy to host a conference in this format because it affords us the opportunity to reach far more participants than we normally do with the on-site face-to-face format. CARPHA is passionate about showcasing and encouraging the conduct of research in the region. In 2020, soon after the COVID-19 pandemic was declared, the environment and epidemiological status did not allow us to meet in person in Jamaica. So that is why last year, for the 65th Annual Health Research Conference, a decision was taken to allow CARPHA to use the digital technology to safely celebrate the region's research excellence in spite of an ongoing pandemic. In the coming days, there will be several pre-conference meetings as scientists and public health practitioners from many disciplines take advantage of the beauty of Jamaica to convene and discuss their plans for regional action. Then the conference begins, and we have a chance to enjoy the research findings that will be presented by our very own researchers, students, young researchers, as well as research stalwarts. The good thing about this conference is the perfect blend of youth and experience, which makes for an exciting glimpse of the Caribbean from a researcher's perspective. In keeping with the tradition of celebrating research excellence, every year CARPHA honors health professionals who have served the region and contributed tremendously to the advancement of the Caribbean health and specifically public health status. This year's awardees are Dr. Victor Blanchett and Professor Suramani Harding. We will also use this opportunity of the face-to-face setting to honor last year's awardees, specifically Professor Denise Eldermeyer Shearer. Minister Tufton, I must single you out for my very special thank you for your unique contribution to the Regional Health Conference, and I especially appreciate the vision for research writ large in the Caribbean that we shared in our discussions this morning. To the Ministry of Health and Wellness and overall the Government of Jamaica for co-hosting this important event, your collective support has been overwhelming and unwavering. Thanks also to all other event sponsors, exhibitors, participants for contributing to this research conference. The planning teams in Jamaica and CARPHA have worked tirelessly and with great imagination. This year will be awesome. And let me tell you, members of the media, we are ready. I invite everyone to participate in the CARPHA Annual Health Research Conference as we explore COVID-19 and digital health, transforming, connecting, and informing public health. So with this brief ceremony, we are going to start our activities. Thank you so much. And I hope you have lots of questions to ask me.
All right, thank you very much, Dr. St. John. We now invite questions from members of the media, both in the room and online. Those online can use the raise hand feature on Zoom and wait to be acknowledged. Okay, so it seems our media members here, well, those in person don't have many questions. We're checking on Zoom. That's a good thing maybe, because it means everything was clear, concise. Okay.
One question I have here is, what is the value of the investment to hosting the conference?
Okay.
Yes.
From me?
Yes.
Okay.
The investment allows for a few things. One, are you listening to me? One, there is this whole issue of people coming into your country, and it's not just the people who will come from the 15th. There are people already here participating in meetings, and this brings investment and money into the country. There is also the fact that this is a prestigious event. It's the biggest health research conference in the Caribbean. It's been running for 66 years. That is an achievement, and Jamaica is hosting it, and hosting it with such a flair. And then there is the whole issue of the content of the research. You have things that will jog the minister to change a program or to implement a program. It will also showcase Jamaica's, as the minister said, Jamaica's research excellence. So there are very many tangible and intangible benefits. And in the same way that the media is here today, I expect them to be all over the conference and making sure that some of these insights from the research findings are shared. Anybody online wants to ask me a question?
There's another one, Doc. They're asking just to explain some of the work that CARPHA is carrying out now, and just explain what CARPHA does and some of the work that you're carrying out now.
Okay, so CARPHA is a CARICOM institution, and we have an intergovernmental agreement with 26 member states. And we are a little bit more than the traditional public health institution, because we also have an environmental arm. We have novel programs like Tourism and Health Program, which worked very hard during the pandemic to keep the tourism product going. We also have the Field Epidemiology Lab Training Program, which ensures that countries have what they need to fight pandemics or even just regular outbreaks. We also have vector-borne disease. We support research ethics. That's one of the things that comes out of my office. And because CARPHA can get the job done efficiently at a very reasonable rate, we're a good investment for our many international development partners when they want to get the job done and take the burden of procurement and all of those headaches, finding equipment and supplies in these really strange times. They can give that to CARPHA. We will get the job done, and the ministries of health will not have that burden. So we're quite an interesting outfit. But one of the things that's most special to me is that we're Caribbean people helping Caribbean people. So the Caribbean excellence is assured. And then we're part of the security cluster of CARICOM. So we work with our fellow CARICOM institutions to ring fence the CARICOM region. I could go on, but I think I better stop.
Thank you very much. Question for Dr. Tufton. in terms of the, now you have outlined the findings of the study, what are the next steps from the study? In terms of policy?
That's the sodium study?
The sodium study.
Oh,
yes.
okay. The next steps would be public education, because I think it's important that individual responsibility is informed and influenced. Then beyond that, it's around how we deal with policies around nutrition. So the school nutrition policy, for example, would be influenced by a list of menus that would go into serving our children. That's a controlled environment. Then it will influence how we deal with things like front of package labeling. So front of package labeling, the concept is to give the consumer a very simple way to determine the nutritional value, or even another way, the warning signs around a particular product that they're purchasing, whether it's excess in sodium or excess in sugars or so on. So the consumer can make a decision around those things. So where we can maintain full control over the environment, like the schools, we do that. Where it's really a consumer choice issue, we give the consumer information. And there are other things that could be done. I don't know if you want to comment.
I want to say
You want to
something.
say? Okay, go ahead.
You said that Jamaica leads the way. You said that Jamaica leads
There's
the
no
way.
Caribbean competition, but go ahead.
So what happens is when Jamaica does this research, it really helps the others to see what's possible. And a lot of that influence is very well communicated by this minister. So it isn't just that Jamaica's doing this. It is that it shows the others how they can get it done too. So it always helps the region. So that's what I wanted to
And she doesn't mind that I give her a hug, by the way. So. No, Dr. St. John is correct. We learn from each other. I mean, we pride ourselves in doing what we think is important, and I think I have a lovely team here, a team that is willing to execute. So it's really a team effort, but we really do see ourselves as one Caribbean. And so a sodium study like this could easily be transferred to other environments, given that they consume the same foods and they have the same health profile. So the same school nutrition policy can be influenced, and I could go on and on. So you're absolutely right. You're taking the regional look. That's your critical role, and I appreciate, and we appreciate that. So it can be extended far beyond the Jamaican shores. So in a sense, that's the benefits of collaboration. All right. I have Parliament, but if you have any other, no?
Those are all questions.
Okay. Would you like anything else to add, or no? Mr. Chairman, would you like to bring closing remarks? You have a script, right? Okay.
All right, so we thank the members of the media for your questions. As has been alluded to throughout the course of this media launch, technology and our ability to tap into the advancements of digital health to improve patient care is key to our region's growth. We hope this year's conference will form a platform and be a key driving factor in this regard for not only ourselves, but for all future generations. Thank you to our Minister and Dr. St. John, members of the media, and our colleagues in health for joining us at our 66th CARPHA Health Research Conference media launch. We look forward to your participation over the course of the conference, including at our town hall meeting on Tuesday, September 13 at the UWI Mona, Caribbean Moves launch on Wednesday, September 14 at the Emancipation Park in Kingston, and our Health Research Conference from Thursday, September 15 to Saturday, September 17. Have a wonderful rest of afternoon.
Thank you. Oh, take a quick pic. Let's move this.